Dr. Bradshaw here at Chirocynergy, talking about strengthening the low back by strengthening the deep pelvic muscles underneath the low back that help support the abdominal organs. This is called Kegel exercises, and for many of you who are women, you've heard of this before. You've probably done some of these before at some point in your life. These are good for you, men as well. You shouldn't be turned off by the fact that women do these for pregnancy. These actually help, as we get older, take the muscles that support the low back. These muscles run underneath our undercarriage and help support all of our pelvic organs. For us guys, the prostate and our lower intestines, as well as for women, ovaries and uterus, to help support those. If they sag, then everything else sags with it, putting pressure on the nerves that run through there, and oftentimes can result in hip pain, buttock pain, sciatica down the legs. So I want to talk about how to do this properly. I want to give you a couple of tips. One, I'm going to show you this here. The pelvic floor is this dark stripe you see across here. The pubic bone's on the left, here's your tailbone on the right. So if you look at me from the side, this muscle runs underneath me like this. It pulls us up underneath, okay? So that's the muscle we're gonna be working on exercising. The positioning is as you see here. So this person here, they're not sitting on their sit bones. This person is. That gets the tailbone in the right position. So when we're doing these exercises, you wanna make sure you're on your sit bones. You're not slouched back like this. That causes the tailbone to tuck under, and now you're actually going to irritate your low back doing this. So you want to make sure that you're up onto your sitting bones, onto a chair, sitting upright, okay? If you feel those sitting bones right there on what you're sitting on, you're in the right position, okay? And what we're going to do is we're going to actually squeeze the muscle that we use to pinch off a bowel movement. So imagine you're going to the bathroom, number 2. You want to squeeze those muscles to stop going to the bathroom. That's the muscle we're going to be working on. So in this case, you're going to hold that muscle, and you're going to hold that for 10 deep breaths. Nothing changes except your breathing, just in and out, is all you're doing, with proper posture sitting on those sit bones, okay? That'll take you about 30 seconds. Then we're going to change it up. We're going to speed up the breathing, and you're going to squeeze only when you inhale. So you're going to take a deep breath in and relax. Squeeze, breathe out, let go. Squeeze as you breathe in, let go as you breathe out. And you feel that in that same muscle. It's only the muscle we're dealing with when we're going to the bathroom. And you pinching that off, that sensation, that's the muscle we're working on the whole time. You do that for 60 seconds. You almost feel like your low back is getting lighter, and almost like the abdominal organs are being lifted up somewhat inside of you. It's a kind of an odd situation and feeling, but in a good way. It feels good. It really helps actually open up the low back. It gives a feeling of lightness, a sensation of feeling lighter in the low back. That is a big deal for people, and this can really play a big role for people who have gotten older and those muscles have just gotten weak. So many of us, both men and women, can benefit from this and will be helped by this. So have fun.